Welcome to Newton Falls School's annual emergency medical updates. Today, students have many medical conditions that may require intervention during school hours. This presentation is designed to give school staff important information about providing care to students in the event of an emergency. First and foremost, it is vitally important that any and all student health information be kept confidential. Student health information is protected under FERPA as part of the educational record. Only persons with legitimate educational interest as defined in FERPA are permitted access to student health information. Staff members will be notified about specific student health concerns of those students under their supervision. This will be done through individual action plans for asthma, bee stings, food allergies, or any other condition that could be life-threatening. Most student health concerns are also accessible through a progress book by clicking on the red cross beside the student's name. Make sure to keep all health information in a secure location, but one that is accessible to substitutes. Examples of serious illness or injury include no breathing or pulse, difficulty breathing, chest pain, back, neck, or head injury, burn to a large part of the body, penetrating injury, eye injury, prolonged seizure lasting greater than 5 minutes, allergic reactions, hemorrhage, poison ingestion, and heat stroke. If a student under your supervision sustains a serious injury or illness, do not move the student unless the scene is unsafe. Notify the nurse and administrator, and if the student's condition warrants, activate the emergency response team button on your phone. Render first aid according to district policy and your training. Notify the parent and guardian, and activate 911 if the student's condition warrants. Asthma is the most common chronic illness in our student population. Asthma can be life-threatening, so it is important to be prepared to deal with a student complaining of breathing difficulty. Students are permitted to carry asthma inhalers with parent and physician authorization. If a student under your supervision uses an inhaler, please document the date and time and forward that information to the nurse. It is extremely important that you verify that the student's symptoms are relieved before sending the student on. If the symptoms are not relieved, follow the steps on the student's asthma action plan and notify the nurse. You will receive an asthma action plan for each student having authorization to carry an inhaler at school. If you do not have a plan, the student does not have appropriate authorization and should not be carrying or using an inhaler. If this should occur, please contact the nurse. Asthma symptoms are triggered by various things, including exercise, upper respiratory infections, and weather changes. In the school environment, it is important to avoid the use of asthma triggers in the classroom. These include air fresheners or candles, in some cases, animals. Signs of a severe breathing emergency include audible wheezing, coughing, or altered movements of the chest. More serious symptoms are a blue-gray skin color, usually first noticeable around the mouth and nose, and/or a decreased level of consciousness. If you observe any of these symptoms, or if the student complains of chest discomfort, have the student use his inhaler. If the condition seems serious, as evidenced by a change in skin color or a decreased level of consciousness, activate the emergency response team. Remain with the student until his symptoms have been relieved or until other help arrives. A child complaining of a breathing problem should never be sent to the office. Call the nurse from your room and let her know what is happening. We will now watch a video demonstrating proper inhaler technique.
Meter correct dose inhalers, which are commonly called puffers or inhalers, spray the medicine out so that you can breathe it deep into the lungs. Inhalers deliver medicine very quickly. Inhalers are compact and light, so they can be easily taken with you wherever you go. It's very important to use your inhaler the correct way to make sure the medicine gets deposited into the lungs, where it works the best. Incorrect technique can leave some of the particles from the medicine on your tongue or throat, where it won't help at all. A spacer or holding chamber is an attachment that should always be used with your inhaler. The spacer holds the medicine in place so you can breathe it in easier. Now, let's demonstrate how to correctly use a spacer and mouthpiece. First, remove the cap from the bottom of your inhaler. When you get your new inhaler from the pharmacy, you need to prime or waste it by spraying the medicine into the air 4 times. Now, fit your inhaler into the opening at the end of the spacer. Shake the inhaler well for 10 seconds. Turn your head to the side and breathe out. Close mouth around mouthpiece of spacer. Push down on the inhaler once. Now the medicine is inside the spacer. Right away, take a slow, deep breath. The goal is not to hear a whistling sound. If you do, this means that you're breathing in too fast. Hold your breath for a count of 10. Now slowly breathe out. Rinse your mouth out with water or brush teeth or get a drink after using controller medicines, such as inhaled steroids. Many times, the correct dose of your medicine will be to inhale 2 puffs. If this is what is prescribed for you, then wait 1 minute after the first puff and then follow all of the steps again. Remember, if you have questions, call your doctor's office, asthma care team, or pharmacy.
Food allergies are another problem commonly seen in our student population. Most food allergy symptoms are mild. However, some allergies can lead to very serious symptoms. The most common of these are peanut and nut allergies. Our goal is to avoid exposure to an allergen. It is a good idea to avoid classroom snacks unless each student brings his own. If you choose to provide a snack, make sure to read the label carefully and call the parent of a student with a known food allergies for further guidance before allowing the student to have the snack. Bee sting allergies are also quite common. These reactions can be local, which means that there is significant swelling and redness around the sting site, or systemic, which is characterized by hives, swelling of the mouth and tongue, and breathing problems. If a student is exposed to an allergen such as a food or a bee sting, symptoms of a severe allergic reaction tend to have a very rapid onset. Most of these occur within 1 hour of exposure. The signs and symptoms of a severe allergic reaction requiring emergency treatment include trouble breathing, weakness, anxiety, nausea, rash or hives, abdominal cramps, loss of consciousness, or shock. Keep in mind that anyone may develop a severe allergic reaction at any point in time. If you observe these symptoms in any person, call the nurse or activate the emergency response team immediately, even if the victim has no history of an allergic reaction. If a student experiences these symptoms and there is no emergency action plan on file, notify the nurse and administrator immediately, as this can be a life-threatening problem. If the student has an emergency action plan that includes use of an EpiPen, please assist the student to administer this injection according to his plan. We will now watch a video demonstration of how to properly use an EpiPen.
I'm allergic to nuts. I can't eat strawberries. Milk doesn't like me. Mommy says I got an allergy. I get all red and bumpy. My eyes get puffy like this. I don't breathe so good. My tongue gets itchy. It made me really scared. This is My EpiPen. 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 My EpiPen. Take it out of the case and pop off the cap. Make a fist like this. Like this. It's like when you sit on laps. Bigger kids sit or lie down. Here's a spot. Just hold my leg still. Press, click, and hold. Be sure to hear the click. Hold it there for 10 seconds. That's 10 seconds. Always have an extra EpiPen ready because the medicine can wear off. Then call 911. Easy, right?
Today, doctors are seeing more and more children with allergies, especially food allergies. In a room of 20 kids, one or more of them will have allergies. While most allergic reactions result in merely uncomfortable symptoms, some anaphylactic reactions may be more serious and even life-threatening. About 150 children and young adults die from food allergies every year in the United States. Due to the unpredictable nature of allergic reactions, over 2.4 million epinephrine autoinjectors, such as this, are currently being prescribed. EpiPens deliver medicine quickly and effectively, but they only work if there is somebody around who knows where the pen is, when to use it, how to use it, and will actually do it. Times when you need to use an EpiPen can be stressful and may even be life-threatening. So it is important to have a plan of action so you can calmly react to the situation. Knowing when to use an EpiPen can be easy. If a child eats something they're allergic to, has hives, and is wheezing, give the shot. Sometimes, however, symptoms may not be as obvious. So if you are in doubt, always give the shot. You may not even have known what the child has eaten. But if you do suspect an allergic reaction, or a child is demonstrating 2 or more symptoms, don't wait. The longer you wait to administer an EpiPen, the harder it is to stop an allergic reaction, mild or severe. And allergic reactions can change from mild to fatal quickly. No child has ever died or has had serious problems from a standard dose of epinephrine. To protect the child in your life, be prepared. Memorize these steps and practice them. Review each child's action plan. Know where each child's EpiPen is located. Epi equals 911. If you get it, call it. Take the EpiPen out of its case. Hold it in a firm fist grip. Remove the cap. Make sure the child is sitting or lying down. Identify the big muscle in the thigh. Hold the leg and the child steadily. Press the orange part firmly against the thigh so that it clicks. Stay there. Don't bounce. Hold for 10 seconds. Press, click, and hold. Some of you may have an epinephrine injector that looks like this. This training device has yellow caps, but yours may have a different color. This has the same medicine as the EpiPen, the same kind of spring-loaded needle, and is used for exactly the same reasons. This injector has 2 safety caps. Hold the injector in a fist grip. Don't put your thumb on either end. Remove both safety caps. The red end is the action end. That's where the needle comes out. Remember, red to the leg. The red end should not touch anything else. Again, make sure the child is sitting or lying down and hold for 10 seconds. For this device, the needle will remain exposed after use. Please put it down carefully or put it back in the case. And if you haven't done so already, call 911. As with any emergency medication or device, please be familiar with it before you need to use it.
Seizures can be a frightening problem to deal with in the classroom or on the bus. Seizures cannot be predicted or prevented, so we must be prepared to assist a student experiencing seizure symptoms. The goal is to prevent the student from injury. Do not place anything in the student's mouth. Lower the student to the floor, cushion his head, and loosen any tight clothing. Activate the emergency response team. Call 911 if the seizure lasts longer than 5 minutes, if the student sustains an injury to the head or other body part during the seizure, or if the student has no history of seizures. Document the time the seizure started and provide privacy to the student by removing others from the immediate area. Choking is a concern in the school environment. If you observe a student who appears to be choking, but he is able to cough, speak, and breathe, stay with him and encourage him to keep coughing and stay calm. If at any point in time the student becomes unable to cough, speak, or breathe, use a series of back blows and abdominal thrusts to try to relieve the obstruction. We will now watch a video demonstrating first aid to a choking person.
When something is lodged in someone's throat, the natural response is to cough. If the person is coughing forcefully, they are getting air. Encourage them to keep coughing. If an adult or child cannot cough, or has an ineffective cough, or cannot speak or breathe, they might be choking. Call for more advanced medical personnel and obtain consent.
Medical responder, may I help you?
Position yourself to the side and slightly behind the victim. Place one arm diagonally across the chest. Bend the victim forward so their upper airway is at least parallel to the ground. Using the heel of one hand, give 5 firm back blows between the victim's shoulder blades. If the object has not been dislodged, give 5 abdominal thrusts. Stand behind the victim and, while maintaining your balance, make a fist with one hand and place it thumb side against the victim's abdomen, just above the navel. Cover the fist with your other hand and give quick upward thrusts. Continue delivering a combination of back blows and abdominal thrusts until the object is forced out, the person can cough, speak, or breathe, or the victim becomes unresponsive. If the victim becomes unresponsive, gently lower them to a firm, flat surface and immediately begin CPR, starting with compressions.
Bend forward.
If you cannot reach far enough around a choking victim to give abdominal thrusts, or if the victim is obviously pregnant or known to be pregnant, use back blows and chest thrusts to try to dislodge the object.
Stand straight. Bend forward.
You might need to kneel behind a child to give effective back blows and abdominal thrusts. Do not use as much force with a child.
If a student sustains an injury while under your supervision, you will need to complete an accident report. These forms are available on the school website and from the nurse. Your documentation should include your direct observations and actions. Make sure to notify the nurse and administrator. The nurse must assess the student's injuries to determine if further medical intervention is indicated. Ohio law states that only persons trained to administer medications are permitted to do so. All student medications must be processed through the school office. Never give a student medication from your own personal supply. All students coming to the office or the clinic for complaints of illness must have a pass. In the elementary and middle school, students will continue to use the written pass. Junior high school students will use the electronic hall pass. Students are not permitted to use cell phones or classroom phones to call parents to go home. Rather, they must be seen in the office or clinic before going home. This concludes the emergency medical updates presentation. Please see the nurse if you have any questions about any of the information presented or any other questions related to student health. You can now proceed to the quiz associated with this program. Thank you.